Hello, everyone, and welcome to SoftFil Academy's first webinar of the year. We are thrilled to welcome all of you. We are waiting like just a few seconds for everyone to connect. Just to give you the program very quickly, we are going to listen to Dr. Weiner's presentation for approximately 40-45 minutes, and then we will answer all of the questions. Please note that this webinar is being recorded and it will be, of course, as usual, available on replay on our website and on our YouTube channel. So you will be able to watch it again anytime you want. Please don't hesitate to let us know where you're from and say hello from the chat. We're always happy to hear from everyone. If you can maybe switch slides.
Okay.
All right, so today we are welcoming Dr. Steven Weiner. We are so thrilled to have you with us tonight. Thank you so much. I'm sure everyone already knows Dr. Weiner, but I'll do a short presentation. He is the creator of the aesthetic clinic. He is world renowned for his filler techniques using cannulas and his rejuvenation procedure, which he performed on the Doctor's Show. He served on multiple advisory boards, participated in FDA trials, and authored several clinical papers. He is #1 trainer for Galderma for the past 3 out of 4 years. He was voted one of the top 100 aesthetic injectors in the US and is on the Real Self Hall of Fame. He was awarded the best aesthetic practice in the US in 2018 at the Aesthetic Show. And he was awarded Best in Destin in 2019, 2020, 21, and 22. So we are honored to have you tonight. The theme of the webinar tonight is temple injection technique with SoftFil cannula and ultrasound. We are very excited for this webinar. Thank you so much. And I will now leave you to start your presentation, Dr. Weiner.
Thank you very much. Thank you for inviting me for this great webinar. And I'm a huge fan of using SoftFil cannulas, as you know. So first, let's talk about the temple anatomy, because that is key when you want to do your safe injections. So the very first layer is going to be, is the skin, okay? And then the next layer is the subcutaneous fat, which is here. So skin here, fat here. Next layer is the superficial temporal fascia, which is right here. It's also known as a SMAS. It's also known as the temporal parietal fascia. And then there's another layer, and that's the interfascial plane, also called the innominate fascia. And you can see running through it is the facial nerve, the frontal branch of the facial nerve. The next layer is the superficial layer of the deep temporal fascia, which is right here. So the deep temporal fascia splits into a superficial and a deep layer. And within that within those two layers is called the intermediate temporal fat pad, which is right here. And what you're seeing here is the middle temporal vein. Then you have that deep layer of the deep temporal fascia. It's kind of confusing. Here's the deep layer of the deep temporal fascia, okay? And then you have the deep fat, okay, or the buccal fat, which is right here. And then you have the temporalis muscle, and then there's periosteum, and then there's bone. So this is a little bit confusing. This is another way to view the different layers of the temple. But the reason I chose this one was to show you the septum. So this is called the inferior temporal septum, and this is the superior temporal septum. And most of our enhancement is going to be between the two septums in the upper temporal compartment, which is right here. So let's show you what ultrasound looks like of the temple. And so on the left side, you see the pulsing artery, which is a superficial temporal artery. That's the anterior branch. That lays within that SMAS layer, or that temporal parietal fascial layer. Okay, and then there is the intermediate temporal fat, and that's bounded by the two fascial layers, as I told you, the deep layer of the deep temporal fascia and the superficial layer of the deep temporal fascia. And then lying all the way deep to that is the temporalis, and then the temporal bone here. So the area that I like to inject is in between the two fascial layers. The fascial layers are where the superficial temporal artery is, and that superficial layer of that deep temporal fascia called the interfascial plane. So we'll go to the next slide here. So the venous anatomy, so the veins drain through the sentinel vein, which pierces through the superficial layer of the deep temporal fascia into the middle temporal vein. And you can tell it's a vein because it's compressing. And what I'm doing with the ultrasound probe is pushing on the skin, and you can see that the flow in that vein diminishes. So if it were an artery, it doesn't compress as easy. So the most popular way to inject the temples is in that deep injection. And I'm going to tell you that there's a lot going on in that area. And so this is where most people would be injecting, but I'm going to tell you that it's not as safe as other areas in the temple. Okay, why is it so popular? It's because it's easy. Okay, normally when you want to inject, you want to stay a plane away from the artery. And right here, we're dancing around the arteries in the same plane that we're injecting. So it's quite dangerous in my opinion. Okay, these aren't necessarily SoftFil's opinions. These are all my opinions here. This is another artery that's often deep in the temporal fossa called the zygomatical temporal artery. Okay, again, look where my probe is. The probe is exactly where you would be injecting. So I'm going to show you a different way. So to further that discussion, I'm going to go over a paper that was recently published by Dr. Nicholas and Codafana and others in December. And what they did is they measured the distance of the anterior branch of the deep temporal artery. So there's two branches, an anterior and a posterior. And there's also further branching of that. But they measured it from the zygomatical rim right here. Okay, so generally what is taught is 1 up, 1 over. So 1 centimeter away from this area is generally where you inject. But look at the data over here. Okay, the data showed the artery at 1 centimeter, at 1 centimeter, at 0.9 millimeters, or 0.9 centimeters, 0.9 centimeters, 0.8 centimeters, 1.3 centimeters. So all around the area that you were injecting, supposedly safe, isn't quite safe. Here's another diagram showing that when you're injecting on a periosteum, you aren't necessarily safe as well. You could think that you're not in the area of an artery, but the bevel could be within the artery. It could be angled or straight and still be within that artery. So here are the conclusions of the paper. The paper stated the variability in the location of the major arteries within the temporal fossa, as well as their inconsistent branching patterns among and within patients, impede the ability to classify a safe zone. Okay, so they basically said there's no safe zone deep in the temporal fossa on the periosteum. I'm going to go through a couple cadaver dissections of the anatomy of the temple. So on the left here, this is, so the superficial temporal artery branches into a frontal branch and an anterior branch. So I'm sorry, a posterior branch and an anterior branch. And so what I'm showing you here is the posterior branch, okay? Now I'm going to show you, this is the anterior branch. The anterior branch is typically the one that is associated with a risk of blindness because it communicates with the ophthalmic system, the supratrochlear and supraorbital. Okay, On the right side, we're going a little deeper. And I'm going to tell you that this is the deep temporal fascia. That deep temporal fascia is quite thick. If you haven't been to an anatomy lab, you need to look at this. It's quite thick. And so when you're putting this gel filler below it, it's asking a lot to push up on that fascia. It is very thick. And I'm going to show you another video. But more importantly, look at all the vasculature laying on the periosteum. Okay, here's one that's cut, and here's several other branches. There's muscular branches and so forth. So there's a lot going on there right on the periosteum, even though it's, quote, safe. So on the left side, this is another specimen, and I'm going to show you, this is the nose for orientation. And this is the superficial temporal artery anterior branch. So it's going off like this, you see, and it's communicating eventually with the ophthalmic system. So here's that posterior branch, okay? I'm sorry. Okay, here we go. So this is the intermediate temporal fat. As I discussed before, it's between the two fascial layers of the deep temporal fascia. And you can see the yellowness of that. And then what's down here? There's another deep temporal artery branch. Okay, so now let's go over to the right side. I'm sorry about that. And the right side, I'm showing how thick that deep temporal fascia is. You see, it's quite thick. And it's asking a lot for HA filler to lift that fascia. So these are the targets that are typically used to inject and enhance the temples. The subcutaneous or superficial fat, which is the lateral temporal cheek fat. The interfascial plane, as I discussed. There are some new studies showing the intermediate temporal fat pad as an injection site, and then the periosteum, which is commonly done. So which is my favorite? The interfascial plane. And I'm going to go through my arguments why that's a good plane. So first, let's go through the different areas and the pros and cons of why they're good or bad. So the superficial subcutaneous fat lies very superficial, and it's superficial to this STA, which is good. But there's also veins in this plane, which is bad. The most important thing that I think is important not to use this plane is that visible product is possible and often seen, okay? There's not a lot of skill to injecting in this plane either. And you can approach this from the hairline, from this direction, from the zygoma, or the superior orbital rim. And you can use either a needle or a cannula. But if you're going to do this, I suggest using a cannula because of the veins there. And the cannulas keep you in the same plane. So this green area here is that target, that superficial fat, okay, also called the lateral temporal cheek fat. So the new area, but this is going to be difficult because you need ultrasound to do this, is that intermediate temporal fat. It's well below the STA, which is good, but it's in the area of the middle temporal vein, which is bad. Okay, there are cases of pulmonary embolus from injections in this temporal vein. It's very unlikely that you'll see visible product, but the skill level is probably the highest because you need to do this under ultrasound guidance. Okay, and you need to use a needle for this because you need to poke through that deep temporal fascia. That, as I showed you, that deep temporal fascia is a very thick fascia. So that's why you need a needle for that. Okay, and over here, you see the green and you see the middle temporal vein within that intermediate temporal fat. So now this is the layer that most people are doing. They're doing a deep periosteal injection, okay? And it's well below the STA, which is good, but it's in the zone of other arteries, which is bad. The deep temporal artery, the zygomatical temporal artery, as I showed you.